We'll next hear from Dr. Prakash Patel, Chief Operating Officer of GuideWell Florida Blue and President of GuideWell Health, and he's joined by John Urbanek, Senior Vice President, Health Insurance Business at Florida Blue, and they're going to share their approach to this new market and what they've been learning in Florida.
Okay, good afternoon, everyone. I'm John Urbanek, and I'm a Senior Vice President with Florida Blue. And first of all, we appreciate the opportunity to talk with you this afternoon and share our approach to the Affordable Care Act here in Florida. So for the next few minutes, I'm going to provide a general overview of our approach, and then I'll turn it over to my colleague Prakash Patel, who will provide some insights on the successful initiatives that we've undertaken with products and the delivery system and service models. I'll then finish up with a few recommendations that we have moving forward. So just getting started, even before the Affordable Care Act was implemented, it was clear to us at Florida Blue that individual decision-making was becoming a key area of focus. We began as early as 2008 to develop key customer capabilities such as retail stores, direct sales, and engagement channels. We've also found that as consumers are now more involved in buying and making decisions, their expectations are becoming higher as well. So we continue to build on these original capabilities, but are also moving into the digital environment, and we're working to connect with individuals in a way that they like to communicate. We also feel that finding ways to keep the customer involved with their plan is going to help improve their health and well-being. As we prepared to implement our strategy for the ACA in 2013, we also knew that consistent with our mission to help people and communities achieve better health, we needed to have a significant presence throughout Florida, and that meant being active in the entire state. We wanted to ensure that we didn't just survive healthcare reform, but rather thrive in that new ACA environment. And since the law was implemented, Florida Blue has been the only carrier to be in and remain active in all of Florida's 67 counties. We also understood that the ACA was going to create a new market. Many people in this new market never having health insurance before, and lots of those people not even knowing what health insurance was. We wanted to be successful with this market for the long term, and so our initial strategy was to educate and to build trust. And as we move forward, we're focusing on providing the tools and the information that will allow members to make better decisions to improve their health. But we're also finding ways to strengthen the relationship and the partnership between the healthcare provider, the member, and us as the payer. With this new market, it's also clear that traditional promotional activities would not be enough. We needed to be there in person to help answer questions and help them make the best decisions. In each year since the first open enrollment period, we've held over 3,000 personal town hall meetings in communities throughout the state to be there for those who needed us. Our retail centers have helped thousands of individuals as well, and we have a dedicated distribution team that's ready for personal meetings and assistance. When it came to products and pricing, again, we planned for the long term, ensuring that we had the products that would meet the needs of this market, but also wanted to ensure that we had pricing that was sustainable. And finally, we've come to realize that we really have to do business differently. The traditional approach of bringing products to market and pricing based on our costs will no longer work. We found that you have to start with what the customer wants and is willing to pay, and then you have to design products and change your company to meet that price point. It's been an enlightening and exciting experience for us, but now we know that each year we'll need to design around customer needs and affordability in order to meet our goal of thriving in this market. So let me turn it over to my associate Prakash Patel to further tell our story.
Thanks. John nicely outlined the importance of having depth and breadth in a market with the ACA. Clearly a nuanced, multi-layer approach to succeed. I'm going to highlight how we translated that market approach to operational execution. As we planned implementation, we realized we would need to balance some strong countercurrents that are vastly different than our traditional commercial business, and that trying to overlay that commercial platform and engine to the ACA would not work. First of all, the majority of the ACA members were not familiar with accessing health insurance products, and that combined with the socioeconomic and language burdens only further underscore that we would need to have a very hands-on approach to engaging guiding and educating these populations. Moreover, given these challenges in concert with the unmet medical needs these members have, and the fact that we introduced new insurance product designs, our providers also needed significant support to ensure the provision of optimal and timely care. Undertaking all of these activities added significant administrative costs, yet the market need is to offer low-cost premium products. These realities in combination put tremendous pressure on our operating margins, pushed disproportionately lower than our other lines of business with significant risk, as many plans experience, for possible losses as well, if not very closely managed. Thus, to help increase our chances to have a positive operating margin, we looked at our administrative processes from front end to back end and made a number of changes. For example, we added more automation in areas like IVR, self-service tools. We also streamlined our enrollment and billing processes, among other processes. Further, to achieve our overall market needs and objectives, fundamentally all of the action steps we undertook best translates into what we reference to here as a hyper-localized and a hyper-personalized approach, very much integrated end-to-end and across all regions of our state and across all functional areas enterprise-wide. These collectively, we felt, laid the required foundational blocks to position us for success. You can see some of the functional areas we focused on listed here. I'll highlight a few of the areas, primarily around care, delivery system, and analytics that we customized and changed for the ACA, which were dramatically different than what we utilize for our commercial book of business. On this slide, historically, and I think this is the experience that many of the health plans have had, we historically have used a centralized approach for medical and care management for our commercial employer marketplace because it worked well when dealing with a wealthier, healthier, more educated population. But for the ACA market, given these populations by and large unfortunately had not had access to health care before, we focused on more intense engagement with these patients, encompassing a wide range of approaches, including leveraging our GuideWell Connect Florida Blue Health and Wellness sites for sales and service, care, and HEDA support. Our customer service advocates were specifically trained to address the needs of these populations. We added a number of consumer digital tools, significant language, specific content, and community events, and incentivized our providers to jumpstart getting these members evaluated. And unlike the centralized approach to case management and care management, we also created 11 new internally localized multidisciplinary care management groups to more effectively deal with a subset of the ACA around complex medical conditions, and also to further build trust with members and providers. And these 11 groups were placed on a localized basis across the state. We call these placed delivery teams, or pods for short. On the delivery side, we sculpted the delivery network system to not only include some of our ACA groups that we know are of the highest quality and best positions that were in the marketplace, but we also leverage some of the groups that we actually happen to own through GuideWell Health, all very, very focused on a hands-on approach and support on the continuum of care needs for these ACA members. Also, the clinical leadership was very primary care driven, and today majority of the strategic providers have incentive contracts in place for cost and outcomes. Finally, none of our cross-functional work could have been done successfully without the tremendous investments we made in analytics, especially around capturing and conveying leading indicators around clinical episodes like ER visits, admissions, readmissions, authorizations for high variability care and high cost cases, and also pharmacy. And then we leverage this information to assist our internal teams and our partner provider groups to intervene as appropriate on behalf of the members for care gaps and risk scores, because the ACA clearly is not just about cost management, but it also is about capturing codes accurately and risk scores for the revenue side of the payment streams as well. John?
Thanks, Prakash. And let me close out this session with just a few recommendations that we feel will improve the ACA moving forward. First, the concept of insurance is the ability to have a balanced risk pool. And we understand and support the need for special enrollment periods in an open enrollment environment. But it's important, however, that we enforce the rules around eligibility for special enrollment periods to protect the ability to maintain a balanced risk pool and not have carriers exposed to selection risk. Secondly, there needs to continue to be guidelines in place to minimize the payment of premiums by third parties. This is a potential source for fraud and abuse that's entirely preventable. Third, there's been a lot of turnover in the exchange market, and this can lead to an adverse risk pool. And one way to help minimize this churn is to require that individuals who left the market owing outstanding premium be required to satisfy that premium prior to re-enrolling in an ACA plan. And finally, there are differences in the grace period requirements between some states and the federal requirements, and this is creating a great deal of confusion and issues. We'd recommend that the federal grace period requirements be adjusted to align with those state requirements.